Welcome, everyone. This is Pat Bailey, Director of Training at Out and Equal Workplace Advocates. I'd like to welcome you to our December 2015 month call, and we will send out that award presentation with Judith that you were just watching as we came into the show with our follow-up email. We'll send you the link to that, so thank you for the National AIDS Group to be able to share that with us. You should be hearing us as a broadcast audio through your computer, so either if you have a headset on or turn your speakers up. If you have a problem hearing the call or it breaks up or you can't pick it up, go ahead and chat to us in the box that is on your left-hand side of the screen, and we'll be able to give you a call-in number. If for some reason you have to leave early today or there's a breakup and you can't get through the entire call, then we will send that out as a recording link after the call as well. We will have some questions for you during the presentation, and so make sure that you come back to the screen and you take a look and you select your answers and then hit submit, and the results will show up there. A couple of other information for you coming up on the end of the year. This is our last town call of 2015, and we'll be starting off in January with our virtual summit. These are some of the best workshops from the summit that we provide for everyone, and we broadcast those, and those will be on the dates you see. There's several dates that we have in there, and then we actually go out to March 17th. So those topics will be sent out through the usual invitation list, and all that will be available for you to take a look at. And please come join us. They'll be recorded as the virtual summit. And if you're talking in your workplace about coming to the summit and you haven't been before, you can also use this as a great opportunity to show your administration and your folks on how to go ahead and see what the workshops look like. January 25th, we're going to talk about our LGBT recruiting, retention, promotion best practices discussion, where we've created a community of practice, and we're working on that. And you can see as we go through February, March, all the way out to next October, there's a lot of activities going on. So do stay in contact, and we'll keep you updated on all those events. And by registering on this call, you will get an invite to come to subsequent calls. So we thank you for joining us today. Let's do a couple of quizzes here as we get started. And the first question is, have you been touched in your life by HIV? And select all that apply. Your options are lost someone, impacted my health, know someone with HIV, know the history. Other, please feel free to chat that in. Not really impacted. And as you hit submit, once you've answered that question, you'll get a chart that shows you the results of the audience. Right now, we have about 51 attendees on the call, and we're a little over halfway have answered the call and the poll there. And we'll give everybody a couple more minutes. Got maybe 10 more people that are coming in on the poll. So it looks like the highest level is know the history, 63.6%. Know someone with HIV, 58.7%. Lost someone to HIV, about 48%. Impacted the choices I make, 31%. 16% impacted my health. Not really impacted, about 15%. And others, chatting in, let me go see if I can see the chats there. Have witnessed the entire history, worked with patients with HIV through the years. So thank you for those comments, Elizabeth and David. Let's ask another question here. And this one is, are you part of the AIDS generation? And select all that apply on this. Remember a time before HIV was even talked about. Came of age late in late 70s to the early 90s. Identify as a man or a woman. Identify as heterosexual, straight, or LGBT. HIV positive or negative. What you did during those days, and hit submit to see those results. This was from an article that came out talking about the AIDS generation, and talked about it being a different perception in your life as history stepped forward, and if you were part of that history or just know about that. And again, we've got about 2/3 have answered so far. I think we've got somebody with a live mic on. And I'll give it just a second or two here. Looks like majority, 73.3%, identify as LGBT, HIV negative, 63%, came of age about half, 55%, in the late 70s to early 90s. Remember a time before HIV, about 44%, watched from afar, 33%, and was at the epidemic front, 14.6%, and identify as HIV positive, about 10% of our audience. So thank you for sharing that. And what we want to do is start our call off today and get some information and insights about the National AIDS Memorial Grove. So I'm going to turn this over to John, and your slide is up. Go ahead, John.
Thank you, Pat, and thank you, Out and Equal, for inviting the National AIDS Memorial Grove to participate. I'd like to just sort of start off if we could all on the call just take a moment. December, a couple of weeks ago, was World AIDS Day. It's an opportunity for everybody to reflect on where we were and where we've come to and where we're going. So if we could just sort of take a moment to sort of reflect on that. And those that we may have lost, I know that in the poll, a number of people have lost individuals, and there will be an opportunity at the end of the call through a poll to actually remember someone. 25 years ago, the National AIDS Memorial Grove was founded. It was 10 years into the epidemic. And here in San Francisco, obviously, the city of San Francisco and the citizens were adversely impacted by HIV and AIDS. And 10 years into the epidemic, after there had been little to no real public response to the epidemic, individuals along the way had been stepping forward in many different capacities to fill the unmet needs. And those were both individuals in the community that saw the need to care for those that were not being given the necessary response from the government, but also it was in partnership with many corporate leaders. And National AIDS Memorial Grove, just a couple of weeks ago on World AIDS Day, was honored to pay tribute to one of those corporate leaders, Bob Haas, who was chairman and CEO of Levi Strauss at the time, and took a very courageous step forward in his workplace, knowing that there was a need to ensure that the most valuable resource that he had, his employees, were given the information and made aware, but most importantly, were given the feeling that the corporate environment that they spent so much time in was comforting and supportive of them. And Levi's in those days was the very first company to come forward with domestic partner benefits to ensure that those who were in need of medical care were given so. 10 years into the epidemic, San Francisco had lost nearly 20,000 of its residents, and although there were many responses in the form of food support, medical support, housing support, financial assistance to those that were struggling and suffering, because as we must remember, when you were diagnosed in those days, you usually lost your job. Oftentimes you also lost your housing, and it was a truly helpless situation in those days. 10 years into the epidemic, it was also clear that those that had survived, and so we've got, I believe, 60 or some odd participants in this call. So the reality of it is if we can think that of the 60 of us on this call, if you happen to be part of one of the circles that was being directly impacted, of the 60, about 20 of you survived. The other 40 did not. And the reality of that was your neighbors, your friends, the barista at Starbucks that served you coffee were dropping and being lost on a daily basis. And the impact of that upon the community was profound. The idea for a memorial was originally conceived by a gentleman in San Francisco, Stephen Marcus, who was a landscape architect. Unfortunately, he passed before the realization of this space was created. But there were other individuals that in his tribute went forward and created the Grove. And it's a 7.5-acre living memorial, healing garden. I think it also speaks to what happened in San Francisco and then across the nation, that the city and county of San Francisco entered into a public-private partnership with a private organization and gave 7.5 acres of Golden Gate Park, which is annually ranked as the top 1 or 2 parks in America. Over the last 25 years, that space has been transformed. It was an abandoned, derelict, and neglected site, forgotten, much like those it memorializes today. It has been done, though, through the hard work and private funding of individuals within the communities and the corporate community. Over the last 25 years, over 150,000 volunteer hours have been dedicated to the space to create this memorial. In 1996, through an act of Congress and a bill written by Representative Pelosi, President Clinton signed into law on World AIDS Day the National AIDS Memorial Grove Act. Leader Pelosi saw what this space did and what it delivered to the community and felt that the same needed to be delivered to the nation. So today, the Grove has three core values: healing, hope, and remembrance. And I think it's important that we all realize that a memorial, yes, is about the individual names that are inscribed in stone, but really it is about the stories behind those names. And specifically and tragically as it relates to AIDS, not only the story behind the names of the individuals lost, but really the story behind the epidemic and the lessons that are to be learned. So as the Grove looks at its silver anniversary starting in just a few weeks, the organization is pivoting to the future and pivoting with a message of hope for the future. And we recently compiled and premiered at World AIDS Day a video that Pat is going to cue up and show now. And I'll come back.
Back in the mid-'80s, people had their entire address books wiped out by AIDS. The impetus for the AIDS Grove itself was there was no place for people just to gather and support each other. Gardens in and of themselves, or nature is very healing. People just needed somewhere to go to feel they were with others suffering like them.
I moved to the city in 1984 as a trans woman. I lost so many people I know to this epidemic in the last 30+ years. Having a space to remember and celebrate them is crucial.
As a person who seroconverted in '97, I may have resisted the Grove, resisting my own disease, my own disability. I knew that people came to visit. I knew that people came to heal and reflect. And for me, I wasn't sure how that was going to play itself out.
As a woman with HIV, there's so much stigma. There was a little period in my own life when I didn't want to think about HIV. I didn't want to think about the epidemic. I didn't want to think about the community. I was really, had spent so much energy just trying to survive.
The Grove finally meant something to me when I came. It felt solemn, it felt quiet, but I also felt supported. This feeling where it was okay to cry.
This is the place that holds the epidemic and holds the stories. And whether those people are living or not, all of our lives are memorialized here, all of our stories.
The AIDS Grove exemplifies the transition from hopelessness to hope.
When I think of hope, it comes back to one thing, it's resilience. In order to find hope, I also have to offer it. It's important for those who have lived and survived and thrived through it, tell the story.
The Grove, in many ways, as it seeks to pivot and tell its story, gets to take what is challenge and turn it into triumph.
Hope has to be about us as individuals and us as a community really climbing out of that stigma and having acceptance and ownership and gratitude. You know, we're not burying 6 friends a week right now. That's not what's happening. I mean, I have hope that I'm gonna die of like an old lady, and I never had that before.
I am hope.
I am hope.
I am hope.
We are hope.
That was an amazing video from the Grove. And now I'd like to bring Stephen Huey in to talk some more about the Grove and look at our World AIDS Day remembrance and what work we can do. Go ahead, Stephen.
Thank you, Pat. 6 years ago, the Grove listened to our constituents, and we decided to hold 2 signature events at the Grove. Every year we do our annual gala, which is Light in the Grove, that takes place on November 30th every year, and that is the eve of World AIDS Day. The video that we showed earlier was 2014 World AIDS Day with Judith Light. And then this PSA, as John mentioned, was introduced this year at our World AIDS Day observance. This year's Light in the Grove and World AIDS Day brought together more than 1,300 to remember those who have died, to honor community and corporate leaders, and to recognize unsung heroes in the fight against AIDS. We've put up the mission of the National AIDS Memorial Grove here for you to not only view but to think about. Our mission is to provide in perpetuity a place of remembrance so that the lives of people who died from AIDS are not forgotten, and the story is known by future generations. Founded 25 years ago, we promised to never forget those who have passed, and the Grove serves as a national living memorial for gathering the personal stories of survivors that we hope inspire future generations with messages of courage, community, humanity, and hope. And these photos that you see included on the slide are boulders that we have placed throughout the Grove. That on the left is the Circle of Friends, and that photo was just taken on World AIDS Day, December 1st, as is the picture on the right, which are community members gathering within the Circle of Friends. So John is now going to tell you about our work days as well as our scholarship program that educates and engages future generations.
Thank you, Stephen. So as Stephen said, the Workday program is really the core of the Grove. 150,000 volunteer hours. It's looked at as a model volunteer program nationally. And it brings together each month between 100 and 150 individuals that gather to till ground, to work. But as was discovered very early on, individuals came to that space to plant a tree or remember a loved one. But in the process of gathering with others that were going through the same struggle and the same pain, it was very clearly discovered that that process brought great healing, to share both their pain, but then to magnify for hope. So each year we also host between 10 and 15 employee resource groups from various Bay Area companies, from Gilead through Wells Fargo, through Levi's, and many others. And they come and bring their employees both to learn about the epidemic, but also to learn about what it means to be involved and engaged in your community, and to show that their organization, stands in solidarity with those that have been lost, but also within their community as a whole. So the Workday programs is really a very powerful process, because the Grove, keep in mind, is the only memorial that we've been able to identify that was created in the middle of what you were memorializing. And that's a very profound and unique attribute of the space. As the mission statement says, to honor all lives, all people who have died from AIDS are not forgotten, and that the story is known by future generations. When we were going through the process of redoing the mission statement several years ago, we used the word story and not stories because the story is much broader than the individuals. The story is about communities that have responded, but also looking at the lessons, the positives and the negatives that have come, because there are great lessons that need to be passed on and shared to future generations to ensure that we don't repeat some of the mistakes that have been made, but also that we share the very positive outcomes that have taken place. 6 years ago, looking at the mission and knowing that future generations are made up of youth today, we embarked on supporting and recognizing young people that are doing work in the community, because all of us that have been in the trenches for a long time are in all likelihood not going to be the ones that solve the epidemic in the end. It will be the next generation. So we started a scholarship program that evolved from just an essay program to a college scholarship program. And actually, I want to commend NMAC and Alex. They partnered with us this last year, and we had over 175 applicants from across the country, and we awarded nearly $50,000 in scholarships, all of them in $5,000 increments. And we brought two of the top winners, one from Florida and one from Seattle, Washington, to be with us on World AIDS Day to speak to the old-timers about what they're doing. And the program was named in memory and tribute to Pedro Zamora, who was one of the courageous young leaders on the second season of Real World. And so we are continuing to ensure that we support the next generation, that they know the story, and that they tell those that have been in the trenches what's currently going on. And so it's something that's very, very important to the organization, and I think important to the cause. There's another thing to keep in mind, the Grove has never taken public money. In the early days of its founding, we made a strategic decision not to take public money because it would have been diverted from direct service care. And so we rely solely on the generosity and support of private foundations, corporate foundations, and individuals. And that's what has supported the scholarship program and other programs as we go forward. So, it's the Grove continues to pivot to the future, to look to hope, and to ensure that the are shared so that we will all grow and honor and know what took place.
Thank you. So the question is, does your employee resource group observe or participate in a World AIDS Day event?
And our options on the poll are yes for many years, yes started recently, no but starting soon, no just individually, no and no plans to start, not sure, not applicable, or prefer not to answer. So you can again click on the submit button, and you'll be able to see the results of the poll there. We're up to 63 on the call at this point, and we've got, again, about two-thirds have come back and answered with the employee resource groups. If you have trouble reading the question, go ahead and go full screen with the small square up in the top right corner of your box. You'll be able to see the entire poll and question there. And it looks like we've got about 22.4% are planning for many years. They've been doing that. About 20% started recently. No individually, about 15%. Not sure, about another 15%. And starting soon, about 11%. And not applicable, about 6%. So let me go into the next one, which is remembering and going from World AIDS Day. And John, I think you're doing that one, right?
That's right. As we do at each work day in the Grove, we gather together at the conclusion of the work day, and we provide everybody an opportunity to speak aloud the name of an individual that they may want remembered. Of course, at the present time, it may not be somebody that's been lost to AIDS. It may just be somebody in their world that needs their thoughts. And so I think this is an opportunity for anybody on the call that had answered that they've lost somebody to remember an individual at this point and to put it in the poll. And as a shameless plug for the organization that is that relies on the generosity of individuals. We're in our year-end appeal, and many individuals make memorial gifts to the Grove. So if you're interested in doing so, you can find us at aidesmemorial.org.
What we'd like to invite everybody to do at this point, if you want to type in the chat the names of those you'd like to remember, we'll go ahead and read those out as they come through. Mike, Eddie, Steve, Leonard, David, many more friends, Arnie, Wayne A. Green, Tom, Jeff, Mario, Lamont, Ken M., Sam F., David J., many others, Tim, Bruce, Dwayne, Orley, David, Chris and David, Bob, Don, Andy, Jimmy, Art, Frank, Justin, John, Paul, David, Jim, Bill, many, many more. And we'll continue as those names come in. When we get another break, I'll get a chance to read through those. But we want to now talk about what's happening now and taking a look at updates on HIV and treatments. And I want to start out with we'll have Alex do the presentation, but let me start out with a poll on his section as well. And the poll is, what do you know about? And select all that apply. What PrEP is, someone on PrEP, what PEP is, how to access PrEP, what undetectable means, about treatment as prevention. So again, this is kind of a checking your knowledge before we kind of get started. And go ahead and answer the poll, and we'll get the answers. Some of the names that have come in since then, Steve was added to that, many more. And looks like we've got about half have answered so far on this poll. And we'll give everybody just a few more seconds here. It looks like we've got about 70%, 65 to 70% know what PrEP is, know what undetectable mean, about 65%, about treatment as prevention, 62%, and then someone on PrEP, about 44%, what PEP is, 27.9%, and how to access PrEP, 30.2%. So with that, we'll go ahead and turn it over at this point to Alex to talk to us some more about PrEP. Go ahead.
Thanks so much, Pat, and thanks to Out and Equal, and thanks to John and Stephen for that great presentation about the AIDS Grove and all of the great work that you all are doing. So for today, I think, we want to be able to think about HIV in the modern context, specifically around the scientific advancements that we're seeing around HIV, and I'm going to, about 70% of individuals on the call, on the webinar, are knowledgeable to some extent about PrEP, and that's sort of the key topic that we'll be discussing today, as well as a few other advancements in HIV. We're going to start things off with a brief video, and then we'll get into some of the details. So before we do that, here's some contact information you may need. We can come back to that later. But go ahead and push play.
I can really just have sex. I don't think about risk. I don't think, because I feel like I got that covered. So PrEP kind of covered me so I could just really invest in sex.
As a sex worker, being on PrEP means less anxiety about the clients I see and the types of sex I have even in my personal life.
But it's also promoted an opportunity for gay men of all generations, both intergenerationally and intragenerationally, for us to be more candid about our sexual desires, our needs, with each other, and that to me seems profound.
So I've seen it tremendously affect their ability to enjoy life, enjoy their partner, connect with other people. It's been amazing.
PrEP is about hope for the new generation because it's about putting the sexy back and being gay and not having to worry and fretting the next day or the next morning about, oh my God, did I get it or did I not?
Thanks, Pat. I think it's interesting, the previous presentation where a large theme that we heard over and over again was hope. And as we talk about HIV today, I always like to remind people that we're at a very hopeful time in terms of the advancements in HIV treatment and prevention, and a very optimistic time in terms of where we are in terms of potentially finding a cure for this epidemic. So it's a really exciting time scientifically. But that contrasts with this sort of social factors that we encounter in this country that are illuminated by 35 plus years of this epidemic. And so the first slide is some new information that came out from the CDC a few weeks ago about rates of transmission. And in terms of new infections, what we've been seeing nationally is that new infections have been going down in every single risk category or transmission category, with the exception of gay men. So in particular, those that are most severely impacted among gay men or young gay men of color. And so if you look at the graphs here on the screen show MSM, men who have sex with men, at that top red bar that has really been consistent for the past 15, 20 years. And you see how the numbers have been either leveling off or going up for young gay men of color. And I wanted to sort of start off by mentioning that in terms of helping us sort of understand where we are in the context of the epidemic. And as we think about treatment and we think about healthcare, what we're reminded of is really the political and social factors that have driven this epidemic from the very beginning. Those having to do with race and class and homophobia and stigma. And so we're at a really interesting time now where we have opportunities to make an impact on the epidemic, as well as an impact on the lives of gay men and trans women and queer people, as well as the relationships that we all have with each other, both personally and intimately or sexually. So the other sort of context is really sort of thinking about the lifetime risk of HIV. And so here we have it broken down by three racial ethnic categories. And if you see the MSM category for all different ethnic breakdowns, are the only ones that are in.
I got there. Let's see.
That's okay. That's okay. Okay. So basically, you'll see the lifetime risk for white gay men is 1 in 6, for Latino gay men it's 1 in 5, and for Black gay men it's 1 in 3. And so that's sort of the reality of what we're dealing with in terms of preventing HIV and making sure that people who have been diagnosed with HIV are in treatment and have access to health care. And I think it's important to point out that when we think about gay men of color and their risks for HIV, it's not necessarily based on the fact that they are participating in riskier behavior than, say, white gay men. It is simply a matter of the sexual networks in which Black gay men are having sex because of the high level of incidence of HIV within those sexual networks. And I think it's also important when we talk about HIV to be able to discuss the trans experience around HIV, the numbers of trans women who the new infections are increasingly going up and up and up. Frankly, we've done a rather poor job of counting trans individuals in this epidemic, and we're finally now just getting substantive numbers on it. But there are all sorts of factors that impact the health of trans individuals. And so here we have it sort of broken down into two categories. One is community, transphobia, the high level of participation in sex work, violence, substance abuse, social stigma. And then you have policy, which is the transphobia that we've seen a great deal in policy lately, like in Houston, for example. Lack of non-discrimination coverage, issues around name and gender changes, and immigration law. So before we get into the PrEP discussion, we have one more video to play for you, and then we can dive into the PrEP and HIV.
In sex work, protecting yourself always has to be negotiated. Taking daily PrEP, I feel like I have better control over that.
PrEP provides opportunities to connect with one another.
PrEP means added protection and empowerment for the bottom.
PrEP has had a tremendous impact on the way that I've been able to experience sexual pleasure. Absolutely.
For sex workers, having something like PrEP available gives us a greater level of protection in an industry where we're constantly trying to protect ourselves from all sorts of harm.
PrEP allowed me, as a black gay man, to own every aspect of my sexuality, even things that I do that most people might not even understand. It allowed me to be fully myself sexually, and being a black gay man, that's a big fucking deal for me.
And so I should also say that we have a whole suite of those videos. We have 5 new 1-minute PrEP videos, as well as 11 more on our website. Of those 11, 6 are in English and 5 are in Spanish. So we have a whole suite of videos about PrEP. They're on nmac.org/prepareforlife. So feel free to check those out later. But I think one of the themes that consistently come up as we talk about PrEP with queer people is the sort of impact it has on their health, the impact it has on their mental health, their ability to have sex and not feel afraid or anxious, as well as what it means in terms of agency over one's body, in terms of not having to negotiate condoms or not having to have the conversation, but instead being fully in control of simply taking a daily medication. So PrEP stands for pre-exposure prophylaxis, and it's essentially HIV prevention pill. It's taken once a day, and it is greater than 96% effective at preventing HIV. It only prevents HIV. It does not protect against prevent pregnancy or other STDs. But that being said, the science is overwhelmingly demonstrated that PrEP is highly effective if taken. It's also been very well tolerated. So here we just have a little bit of information about sort of the side effects that one might experience if they take it. So in the majority of people who took it, they experienced what would be considered the startup syndrome, so nausea, vomiting, dizziness, etc. That happened in less than, that was like 1 to 18.5%. There are other more significant side effects that may happen that happened in a much smaller percentage of those on PrEP, and that had to do with renal or kidney functions, as well as bone safety, bone density issues. As I mentioned, that's extremely rare, and if it is caught, for example, the renal issues, if it is caught, one can go off of PrEP and it's reversible, so you won't have long-term damage, even if you happen to be that very small percentage of individual who has that side effect. The medication that we use for PrEP is called Truvada. It's made by Gilead, and it is actually 1 pill, but there are 2 HIV medications in that pill, tenofovir and intrasibavine. And the pill Truvada has been around for over 10 years and used as treatment for people living with HIV. And so PrEP was approved by the FDA about 3 years ago. And one of the studies that helped earn its approval was a study called IPREX, and it was a study of gay men and trans women here in the U.S. and in South America. And an extension of that study was IPREX-OLA. And so here, what they were able to find is that if individuals took the pill 4 or more times, they had 100% coverage and protection from HIV. The FDA recommendation, the CDC recommendation, and everyone will recommend that it be taken daily. But the importance of knowing that 4 or more provides coverage is that there's high forgivability. So if someone misses a day, it's not the end of the world. They can take it the next day and they're going to be fine. And so I think we've seen other studies around PrEP happen globally, one in France and one in the UK. And this slide, the IPREGAY study, basically was showed the effectiveness of PrEP in the real world. And it was 86% effective, and this was when PrEP was taken on demand, which meant before sex, after sex, and during sex. And I mentioned these studies again. Here's the one that happened in the UK. It also found to be 86%, because there's been a great deal of discussion and debate around adherence to PrEP, daily adherence to PrEP, and whether or not PrEP can work in the real world. And these studies that happened in Europe demonstrate that they can happen in the real world, that it can still be highly effective, and that if someone were to, that there's a high level of forgivability with PrEP, so that people can take it on a regular basis, take it daily, but if they happen to miss a dose, they'll still be just fine. And so I think that what we've found around PrEP is that one of the biggest issues becomes access to healthcare and coverage. And so we're going to show you another very brief video about the topic of access, and then I'm going to cover some of the key topics in that.
I think it's really important for the provider to make the patient feel comfortable and not judged. So I like to just say to my patients, hey, have you heard about PrEP? In an enthusiastic, lighthearted way, so that they know that I'm excited to talk to them about this and I'm not being judgmental about their behaviors.
PrEP is a wonderful advancement, but it's important that those individuals from communities most impacted have access to it.
Access to health care for Black gay men is paramount. It is incredibly important that not only we have information, but additional resources so that we can change lives.
It's a game changer as far as our ability to decrease the risk of HIV infection and hopefully turn the tides on the HIV epidemic.
So as we talk about access to PrEP and access to healthcare in general, PrEP tends to simply illuminate the severe problems that already exist in our healthcare system. So the health disparities that are faced by people of color, by immigrants, by poor people, by queer people, unfortunately are only further illuminated when it comes to accessing PrEP. So here we have a sort of negative-positive double helix in terms of if you encounter a negative or a positive individual and they need to, what's their sort of trajectory or journey, their healthcare journey when they're negative or positive. So ideally you want both of them to be linked to care. You want them to get an HIV test, and depending on the results of that HIV test, they're going to go in two different directions. So the positive individual you want to once they've been tested, as well as tested for STIs and screened for other issues like trauma or domestic violence or drug use, etc. Get them into care, keep them in care, get them on antiretroviral medication so that they can achieve an undetectable viral load. And this is where it's worth pointing out that an undetectable viral load, and many of the people who answered the poll seem to be knowledgeable about what undetectable means that the level of virus in one's body has reduced to such a low level that the current test that we have can no longer test it. It does not mean that the virus is no longer in the body. It just means that it doesn't show up in the high numbers in terms of that specific test, and so we refer to that as undetectable. It also means that if one is undetectable, that there is less than a 4% chance that they can transmit the virus to someone else. So that means it's virtually impossible to transmit the virus if you're undetectable. Other studies have shown that there was zero infection between negative and positive individuals when that positive person was undetectable. So that in of itself has sort of transformed how we think about HIV, because HIV positive individuals if undetectable, are not infectious. That has a profound impact on one's sense of self, on one's sense of whether they feel infectious, whether they potentially could infect their partner, profound impact on the sort of intimate connections that negative and positive men can have with each other. And it really means that if we get the secondary impact of that besides that fact that undetectable means that you can be healthy and HIV positive and live a long time, that's the primary concern and impact of treatment. And secondarily, it means you can't transmit the virus, and that will have a real impact on the course of the epidemic if we get as many people as possible tested, diagnosed, and into care so that they can achieve an undetectable viral load. And then switching over to HIV-negative individuals, it's basically the same process, starting with an HIV test and screening. And then if you are negative and PrEP is an option that seems right for you, and it's worth pointing out that PrEP is, anyone can access PrEP. So whether you're a gay man, trans women, heterosexual, IV drug user, PrEP can work for you. Any doctor can write a prescription for PrEP. It doesn't have to be a specialist or an infectious disease doctor. Any doctor who can write a prescription can provide that medication. And then, as we mentioned in terms of side effects, one of the good things about the protocol that comes with accessing PrEP is that an individual has to see their healthcare provider every 3 months. So most HIV-negative gay men aren't regularly engaged in healthcare, and so this is a great vehicle to make sure that negative men are engaged in healthcare, can foster a relationship with their healthcare provider, and get access to all of the preventative and care services that they may need that may not have anything to do with HIV. So they'll be counseled for harm reduction and sexual health, tested for STIs on a regular basis. And all of those, their kidney and bone density issues functions will be monitored. So if on the off chance that they are experiencing those side effects, those will be caught and dealt with swiftly. So aside from being lucky enough to go to the doctor and get a prescription, the way that one would access PrEP is either if you have private health insurance, if you're part of the health exchange, Medicaid does cover it. And actually, Medi-Cal in California has been very good in terms of their coverage of PrEP. There are also community clinics or federally qualified health centers and some clinical studies that have been happening throughout the U.S. I think, it's also worth pointing out that there has not been an insurance provider that has not covered Truvada for PrEP. There was briefly a moment where one insurance provider decided they weren't going to cover it, and there was community pushback, and they quickly changed their mind. But the challenge is that if one healthcare doesn't cover all of the costs that go along with accessing PrEP, then people run into barriers. Aside from the barriers that they might run into when they encounter a doctor who's not knowledgeable about PrEP, or a doctor who may have bias and not want to prescribe PrEP, it's worth pointing out here too that the CDC actually has a great resource for how to talk to your doctor about PrEP. So one could download that, take it to their doctor, and say, hey, look, this is what the CDC is telling us about PrEP, and this is your information. So it's really great to be able to not only be sure that the doctors have as much information as possible, but that the individual who is accessing care is armed with as much information as possible. So here's a slide that's specific to California, and I realize that not everyone is going to be California, but a lot of us are, and it's sort of the best case scenario in terms of the plan that one would follow. So you would want to check your insurance plan, see the coverage, find a provider, then you'd go into the sort of protocol of getting your health monitored, getting that prescription, picking up that prescription, and paying for the medication. And so there are actually a lot of really great options to help for pain specifically for the medication. Gilead has a copay assistance program. There's a patient assistance network, the PAN Foundation, which is listed here, to really help cover the cost of that medication. So if the Gilead copay assistance program covers up to up to $300 of the cost of the medication if your copay is up to $300. And anyone can qualify as long as they have a prescription, whether you are a resident or not. So in California and other places, obviously, a documented status is critical. And there are, the other concern is sort of the wraparound services, so tests that may needed, like the blood tests, the screenings that happen. And so places like California and Medi-Cal, other states like New York and Washington have been very aggressive and really good at assuring coverage. But the key issue we're seeing around PrEP is really access. And that's the one that our community has to really be committed to assuring that any of those disparities can be dealt with. I know I'm flying through a lot of information, so we'll have plenty of time for questions at the end, but if I'm not covering something, we can get to that. And then finally, here's just sort of a visualization to put it in context in terms of the daily HIV prevention pill, similar to birth control. And adherence has become a key issue in terms of PrEP. And so what I always like to remind people of is do we want to invest in adherence now for someone who's negative, or wait until they test positive and then invest in adherence to their anti-HIV retrovirals once they've already seroconverted. And then the other, I think, key thing to point out when we talk about PrEP and HIV in general is that there's still a great deal of stigma that individuals encounter in regards to HIV. So whether you're one's HIV positive, there's stigma that is dealt with there, and then there's stigma around someone's decision to go on PrEP. And a lot of that stigma really rests with one's willingness to speak openly about the fact that they want to have sex and not use a condom. And so we as a community have to be prepared to engage one another in a way that's sex positive and affirming to our sex and health and relationships in a way that's proactive, as opposed to judgmental or scolding or castigating. And so we know that the stigma surrounding HIV can be an enormous barrier in terms of access to care, access to prevention. And so it's always worth reminding people that the stigma around HIV may have evolved, but it's still quite an issue. So that's my last slide. I'm handing it back to Pat. Thanks so much.
Excellent. Thanks, Alex. Great information. And I want to turn it over to Chris now, who's going to talk a little bit more about how you bring it into the workplace and how we have these discussions. This is a lot of great information, but we still want to take a look at that. So, Chris, I'll turn it over to you.
Thanks, Pat. My name is Chris, and I am the co-chair of the SF regional affiliate of Out and Equal. And what I'll say is corporations have gotten pretty savvy these days about addressing all these social issues, both internally and externally. However, a lot of the times, they only have so much space on their intranet sites or so much money that they can hand out to any given cause. So as most of you know, working for ERGs or BRGs, a lot of the push and engagement comes from you and the work that you do with your teams. So the next slide, we'll kind of talk briefly about how your ERG or BRG can help activate your firm. An idea is to, you got most ERGs and BRGs sent out monthly newsletters, so you can highlight it in different newsletters throughout the year and not just during, AIDS, World AIDS Day or LGBT month in June or July. And in this slide, I've given some resources such as the NPR. They did a great thing for World AIDS Day for the faces of people facing HIV/AIDS, which kind of also helps the message be a little more inclusive, because instead of just focusing on the LGBT community, it really shows how wide the population is and desperate the population is that faces this epidemic. And then another great resource that I found while I was preparing for a PrEP event here locally, which we'll talk about in the next slide, is the Advocate, I believe it was last year, did a great series called 31 Days of PrEP. And there's a link there, which you can then go visit and kind of look through and see if there's anything applicable for you to that you can then share with the rest of your firm or your group. Another idea is to partner with local organizations to host an educational mixer or virtual seminar, and we'll talk more about that in the next slide. And I know that a lot of people who are on this call aren't here in California, so what I've done here is there's a great link to that will list state by state different AIDS and HIV organizations that you could reach out to if you're interested in doing the event. It's very important, Out and Equal is all about being an inclusive workplace environment, so it'd be really to your benefit to broaden the scope of the message to be inclusive. HIV does not discriminate, and it will, as you can see in the last slide, it will hit every sector of the population. PrEP is often used in committed mixed status couples, and by being inclusive, it'll help break down stereotypes and ease any hesitation some might have in participating in such an event. And it's very important to utilize your resources such as Out and Equal and other ERG and BRGs in your local area that will help you maximize your reach and your resources. And also, most importantly, is to keep the momentum going. So the focus isn't just on those specific months or times of the year. So work with your ERG or BRGs to do stuff like the work day for the National AIDS Memorial, or they have healthy packets that some clinics will make for people that are at risk, and then you can or do the AIDS walk or the Big Gay 10K or other type of volunteer events. Now, what I wanted to do next is to just kind of give everybody kind of like a template or a meeting in a box. So if you want to do an educational mixer, or there have been some talks from national to try and help local regional affiliates stage kind of regional summits. This could be a standalone event or a session within your regional summit. So what we did here locally in San Francisco is we hosted a moderated discussion panel, and we partnered up with a local AIDS organization, which for us was San Francisco AIDS Foundation, and specifically their First City Council. And then it was done between them, the regional affiliate, and the local Pride Network for BlackRock. So it's a great way to get involved with your regional organizations and network with other ERGs. If it's an in-person event, it's always beneficial to have a mixer component, a networking component in it, such as cocktail hour. And for key speakers to consider including an expert on PrEP, such as Alex or somebody else like that, a representative from a local clinic, somebody from the health insurance industry. And I'll stop here really quickly because it was really surprising for me to see on the poll that 68% of people knew what PrEP was, but only 30% knew how to access it. So this is going to be a huge component, and it'd be very beneficial if you can get somebody from the health insurance industry to kind of talk about this, because as you can see here, PrEP costs about $1,500 a month, and once again, Gilead does sponsor a copay assistance program. And it's always great to have 2 or 3 individuals currently using PrEP so they can talk about their personal experiences, any roadblocks or stigma that they encountered while trying to gain access to PrEP. And then it's always good to keep them diverse. For us, we've hosted one event and then attended another one as research, and it was interesting to see that speakers include young professionals, elderly, and at a community event, there was even a straight woman who was on PrEP in order to conceive a child with her positive husband. And then while you're at the event, be sure to have informational takeaways, such as a pamphlet from your partner organization, or if you don't have that, there's a link to a CDC guide on how to speak to your healthcare professional, and I think Alex included that in his slide. Sorry, I was rushing through everything really quickly, but we just want to make sure we have time for a Q&A at the very end.
Thank you, Chris. Great job on that. We did have one question on the insurance and availability. I think you answered that, and I think that that's probably the next big push. Alex, do you want to say anything more about that in terms of what to do if you come up in your insurance and they're not paying it as a copay, or who's covering it?
Yeah. I mean, I think that what's sort of key to remember in terms of insurance access is, as I mentioned, there has not been one insurance company that isn't covering it, and some people have come out very clearly saying that they will cover it, like Kaiser, for example, and Medi-Cal does cover it. But what happens sometimes is that they have what they call a prior authorization, which means that essentially there are extra hoops one has to jump through in order to access it. And those in and of themselves can be a barrier. We're trying our best to make sure that we can remove them, but as of now, they still exist. So that might involve more paperwork from your doctor. That might involve a call from your doctor, your physician, sort of explaining why they're providing this medication. But by and large, insurance companies have actually been surprisingly quite good in terms of their coverage of PrEP. The issue becomes, for example, in states where Medicaid hasn't been expanded, if you're HIV negative and don't have access to health care, how are you going to pay for your doctor's visits, not to mention your medication? And when we think about all of the great coverage that we have, medical coverage for HIV-positive individuals, those dollars come from Ryan White, and Ryan White dollars cannot pay for PrEP. So that's the other challenge, is that those sort of dollars aren't moving to PrEP, they're moving to HIV.
I know we're coming right up on the top of the hour, and I know that one of the things, as we've done with transition benefits, is making sure we ask that question. It's probably a great opportunity for ERGs and BRGs to pick that up. I've got a couple more questions, but I want to get to the closing comments because I know we're at the top of the hour, and we'll include those questions, and I'll ask the presenters, we'll send out their emails to kind of respond to those generically as we go through there. So, Stephen, why don't you go ahead and start your closing comments there?
My closing comments are really around that the National AIDS Memorial Grove is everybody's memorial, and the fact that we are national, we welcome all those who would like to remember those as well as honor those at the Grove. And if you have any questions or would like more information, please contact John or myself.
Okay. And John, are you still on the line if you've got any closing comments?
I am indeed. I again want to thank you, Pat, and Out and Equal. And again, if anybody is interested in learning more about the Grove and taking a virtual tour, you can visit our website at aidsmemorial.org. And I think that it's also nice for us just all to go forward and remember in this season those that we've lost and what the lessons are of the epidemic. Because at the end of the day, when it's all said and done, your national memorial will be the one responsible for ensuring the story is known. Thank you.
Great. Alex?
Well, I too would like to thank Out and Equal and Pat and everyone on this webinar today. I think that when we think about the advancements that we are seeing around HIV, I think it's a very, very hopeful time. It's a very exciting time, and we have great opportunities to ensure that HIV positive as well as HIV negative can live long and healthy lives. And the impact that it can have on our community and our relationships really are profound. But it's going to take a great deal of advocacy and commitment, and I'm excited to see how our community will be able to do that. If anyone has questions or needs more information, please email me. Check out our website, nmac.org/prepareforlife. Thanks again.
Excellent. And Chris?
I think that this HIV/AIDS is a great space that is available for ERGs and BRGs to step up and, engage their networks. And I know that a lot of ERGs and BRGs have kind of stipulations on their budget spending and are required to do a lot of, content-based events. And this is a great way to both educate and engage and network for your groups. So please feel free to reach out to me or any of the people on the call for additional information or help if you need.
Excellent. Thanks, Chris. And again, we will send out an email after with a lot of the links and the emails so you can reach out and have the questions. We had a couple more questions come in right at the end. And this is a great topic, and I think we can definitely apply it into the workplace and open those discussions up. Thank you, as our presenters, Stephen and John, Alex, Chris, for a great job, all of you for attending and all the support you've given us all year long. We're going to start right back out in January with our virtual summit on the 12th. and our next town call will be later in January, usually the last Thursday. Again, in your giving plan, if you can consider Out and Equal for a donation, and make sure that you sign up for the summit. It's coming up, and we'll get more involved and have more of these discussions. So thank you, and have a great holiday, whatever that looks like for you. So thanks a lot. Bye-bye.
Please stand.